We'll take you now to the Johannesburg CBD, and Ziniko Mhlaba is there, continuing to get reaction to the changes in these various portfolios, and homes in now on the appointment in the health portfolio. Ziniko, good morning. All right, so you've been talking about different aspects from education to labor and so on, and now we're focusing on health, a big portfolio, big shoes or big objectives to accomplish in this one.
That's right, Emmanuel. Understand that now Dr. Motsoaledi is returning to the Ministry of Health. This is his second stint in that portfolio, and of course now Dr. Phaahla becoming the deputy to Mr. Motsoaledi himself. However, what's interesting is that both doctors have worked together before Dr. Motsoaledi was deployed to the Home Affairs Ministry. At that time, when he was the Minister of Health, he was deputized by Dr. Phaahla himself. They are returning to a portfolio that has many challenges, especially when it comes to infrastructure development of various hospitals in South Africa. Remember that when there was that huge debate about whether South Africa is ready for the NHI or not, one of the bigger issues which was identified as a major problem was the issue of infrastructure in the health portfolio, especially when it comes to some of the oldest hospitals in South Africa. But also the shortages of health workers themselves was one of the things that was also highlighted. So to get reactions on these particular matters, I'm joined now by Mr. Anele Yawa, who's the Secretary General of the Treatment Action Campaign nationally, to give us their reaction. Mr. Yawa, thank you very much for your time. Interesting time in the health portfolio. Do you think the return of Dr. Motsoaledi, talks to the issues of stability and continuity and someone who's familiar with the challenges, or it talks to the issue of not actually addressing issues he had to deal with and failed to do in his first term? So between these two, how are you reacting to his redeployment to the health portfolio?
Thank you, Mhlaba. One is TAC, we welcome the announcement by the President of the new cabinet, and it is too early. We need to give them some time. But also our first concern is that it is too bloated. We cannot have 77 members of the cabinet. And the question we're asking ourselves, what will that mean in terms of the budget? But also coming to the issue of Dr. Motsoaledi. Dr. Motsoaledi is not a newcomer in the Department of Health. You will remember that he became the Minister of Health for 2 consecutive terms. And during his tenure as the Minister of Health, he tried by all means to assist the country in terms of initiating the majority of people living with HIV on antiretroviral. And then after that, he was removed to Home Affairs. He is coming back. But even before he went to Home Affairs, he is one of the ministers who have been in the forefront in the crafting of the NHI. You remember between 2012 and 2017, there was an NHI pilot project which was implemented in 12 districts, and he has been in the forefront of that. And secondly, Dr. Motsoaledi is not a newcomer in the department. He understands and knows what are the challenges within the public health sector. So we think that if he is willing to work with us, we can work with Dr. Motsoaledi, but we don't expect him as an individual to overturn the whole situation of the public health if he does not get the support of the MECs of health, because issues of budget allocation and all what have you does not entirely rest with the National Department of Health. Those rest with the provinces, and that's why we expect that the MECs of health from across all provinces will work together with Dr. Motsoaledi, with the people, to make sure that we fix the state of our clinics. We hire more healthcare workers, more especially the frontline healthcare workers, so that we can curb some of the challenges our people are confronted with on a daily basis. Long waiting hours, shortages of medicines, and clinics that are very small where they are becoming congested. So these are some of the things which we think we can push together in making sure that By the time the country is ready to implement the NHI, we have made the ground fertile for NHI to be implemented in the country.
I mean, so basically saying this is the win for the NHI debate, especially for organizations such as TAC that have been championing for the implementation of NHI. You're also mentioning the issue of budgets. What are you referring to? Are you talking about budgets for hiring of more health workers, or are there any other matters you think an increase in budget for the health portfolio can actually address many other issues?
Yes, Dr. Motsoaledi is not a newcomer, and we believe that since he's got a vast experience within that department, he will assist in bringing about health reforms that will make conditions on the ground favorable for the NHI to be implemented, because we cannot be talking about the NHI if we do not have enough doctors, we do not have enough nurses, our clinics are in a state of collapse. These are immediate things which needs to be fixed by a minister, so that when the NHI is implemented, we know that our clinics are ready, we have enough medicines, we have enough doctors. But also, if you do not get the support of the MECs, because health budgets are determined at a provincial level, and that's where we expect the MECs to work together with the Minister of Health in order for all of us as the public healthcare users to be able to see health reforms being implemented immediately.
Thank you very much, Mr.
Thank you, Mhlaba.
Thank you very much. That's Mr. Anele Yawa there, who speaks as the Secretary General of the Treatment Action, very much warmly welcoming the return of Dr. Mhlaba, saying that, well, it's a win for the health portfolio that Mr. Mhlaba is returning to that, but also emphasizing the issue of working and improving relations between the national and provincial government to ensure that people on the ground do get, efficient health services in and around the country. Back to you, Iman, for now.